We're exposed to risks for cancer almost all the time. And it's the kind of thing that everybody hopes that they will never hear a doctor say about them. We're going to talk about some of the risks for cancer and how you can minimize your risks in this program. We think it will be very beneficial to you. We hope you'll join us for the program.
The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented. Welcome to Help Yourself to Health with Dr. Agatha Thrash of Uchee Pines Institute. And now, here's your host, Dr. Thrash.
We all understand that the immune system is involved in our getting cancer. Sometimes we don't quite understand how. We may have led an exemplary life so far as our immune system is concerned. We've done everything we know. We've been very faithful about exercise. We've tried to minimize our stresses. We have eaten the proper diet, and still we get cancer. We don't know everything about how to avoid cancer, but there are a number of things that we do know, and we'd like to talk with you about some of these. That the immune system is involved is very clear, and all of those things that we can do to keep the immune system functioning at a high level that will give us a resistance against the cancer that we know is certainly a plague in our population. Cancer rates are going up, and chemicals in our society are going up. Things that injure the immune system in some way, these are increasing. So as we understand these things, it can make us so that maybe I shouldn't even go out of doors. Well, we don't want to get that attitude about life. We can indeed participate in everything that goes on around us and still have a resistance against cancer. We know that we're not going to live forever unless the Lord comes soon, and we are translated. And so with the fact that we need to live in this life, we need to learn how to protect ourselves from the world. With this, we can then begin some research with a more concentrated and crystallized effort. Now, with the immune system, we know that exercise boosts the effectiveness of the immune system. We know that simply staying warm, having warm extremities, warm arms, a warm neck, the face, we can have it cold. The face is on a different circulatory system and doesn't affect the immune system at all. But the legs, the feet need to be warm. If they're not warm, then it reduces the effectiveness of the immune system. It is also a fact that a plant-based diet is effective in keeping the immune system in peak functioning condition, and that animal products, a number of them, have been associated with certain cancers. A high fiber diet strengthens the immune system and also lessens the number of cancer-producing agents that we keep in our bodies. Now, I have Dr. Don Miller with me this morning, and he is going to tell you about food and how food is involved in the production of cancer. Dr. Miller?
Well, first I'll say rather than trying to study what is cancer and what causes cancers, the best thing to do is find out how not to have cancer in the first place. And so I get to have this little piece of talk in about 5 seconds. Fruits, vegetables, whole grains, nuts, and seeds. That should be enough said. That is an anti-cancer diet for the most part. Now, let's take it one step beyond there, because even with that, there is a danger in sometimes the foods that we have. And so I'm going to go through 4 simple steps. Once you have fruits, vegetables, whole grains, nuts, and seeds, how do we prepare and take these things in? The first thing is you select them carefully. We realize that sometimes, and almost all the time in many places, the foods have been sprayed with herbicides and pesticides and whatever else, and these themselves can be carcinogenic. So we have to make sure that our foods have been well washed and as much as possible not taken from places where we have carcinogens in the very things that are being put on these foods. And so we get our foods from the most healthful source. We find that foods that have already started to decompose themselves are themselves unhealthy and could be carcinogenic. And so what we want to do is get foods in as best shape as we can. Second step is we want to prepare them carefully. How do we do this? As I've already mentioned, we clean them, make sure we got all those things that might have been on their surface off of them. We're talking about the grapes, we're talking about the bananas, the apples, the carrots, everything needs to be washed. Wash your lettuce. These are very good things. Next step is ask God to bless it. If you've done your part, He will do His part. And then the fourth thing is just eat it and quit worrying about it, because if you think it's going to hurt you, it probably will. There's other things about the foods that we need to be concerned with. Dr. Bruce Ames, a number of years ago, he's a biochemist. I don't know whether you're still there. He was at the University of California in Berkeley. He came up with a list of things that were carcinogenic, food carcinogens that we have in our society that are quite common. And some of these might surprise you. One is burned foods. If you scorch your foods, as soon as you scorch the food, it has become carcinogenic and it needs to be rotated into the compost bin. You burn your toast, you're cooking some cereal and you burn it at the bottom of the pot. What I do, if I ever do this, I usually use a crock pot, but if I do burn my cereal, I will put the pot immediately in cold water, and which will draw these things that are causing the flavoring down into the burned part. And if you taste the top part and you do not taste the burn, it's probably okay. So stay away from burned food. Second thing he mentions is damaged potatoes, as strange as that may sound. When I first heard this, I said, I'm not going to do that anymore. I used to go to the store and buy, the 10-pound bag, the 15-pound bag of potatoes. Now, when I go to the store to buy potatoes, I pick each one up and I examine them all around, because often in the harvesting process, they are damaged by the harvesting tools. And if they get that cut in there, the cut will somewhat heal, because see, the potato will try to heal, but what's happening inside the potato, when it gets invaded by that hoe or whatever it is that just hit that, it thinks it's a foreign invader of a live type, and it starts producing some types of chemicals that will kill that thing that's invading it. Well, after 3 days, it's carcinogenic, and it can get you too. And so it's best not to eat damaged potatoes. Another thing he mentioned was mushrooms. I think he said 2 out of 3 of the most common forms of mushrooms in the markets are carcinogenic. Now, we're not saying if you eat a mushroom it's going to give you cancer or a piece of burned toast, because we've done these things all of our lives. But for some people, these things can lead to cancer. And so, being the fact that we're getting older or we're in a more polluted world and our immune systems are getting weaker, it's very best thing to do is to do everything we know to stay away from these problems. We also realize, now back in the 1800s, a little old lady was talking about cancerous germs. Well, this is before viruses were discovered. Now we realize that cancer is often viral related. That is, a virus being transmitted into the body. And basically those viruses many times come from animal products. And so again, to protect yourself from cancers, fruit, vegetables, whole grains, nuts and seeds, stay away from the animal products, because they are a teeming laboratory of viruses and bacteria and other types of organisms that we really don't need to fight in these already weakened bodies. And so a little bit of things about the foods there. Of course, keeping the sugar content down. As we take sugar, Dr. Thrash just mentioned the immune system. Sugar suppresses the immune response, and many other things in our environment do. But let's eat a good, healthy, clean diet. And Dr. Thrash, I think if we do this, we'll probably not have to meet our appointment with cancer.
I certainly hope not. Then another thing that's a big factor in some areas is the water. We know that that certain big water supplies for prominent cities like Chicago and Atlanta and Los Angeles, that the fish living in those rivers and lakes have cancer. How did they get cancer? Well, it's probably from agricultural runoff or big feedlots of animals or some other place that pollutants can get into the water supply. And then the second thing that makes the water so that it can be cancer producing is that the very purifiers themselves put into the water to purify it and make it so that it's all right for people to take into their homes. These things also can, in some instances, apparently be involved in increasing one's risk of cancer. Whatever it is about water, every municipal water supply where it has been tested in many of these areas, most of the big cities, just 10 miles outside of the water supply district of the municipal water supply, the cancer rates are lower except where there are farmers who are using various kinds of chemicals on their crops. So water can be a serious problem for us. But then another thing that we find that's a serious problem that increases one's risks for getting cancer is lifestyle. And Dr. Miller will talk with us about lifestyle now.
There are various lifestyle factors that we find are more promoting for cancer, whether it's the lifestyle of the occupation that you have, lifestyle in what you do for recreation. Various things are going to cause us to be more prone to get cancers. I remember, I have in my mind right now, when I was a child, I went to a place called Coney Island in Cincinnati, and I remember seeing a man laying there, and he was as brown as my shoes and just shriveled up. He was probably wasn't all that old, but all that sunshine was setting him up. Now, a little bit of sun's not bad. As a matter of fact, it's not bad to get a suntan, but these people who lay out there and get the sunburns, a sunburn sets you up sometime in your life for cancer. Now, I'm not saying that you're going to get cancer if you've been sunburned, because most of us have been, but one sunburn in your whole life will leave you open for melanomas. And so what we want to do is protect the skin. So those people who have either through their recreation get too much sun, or through their occupation gets too much sun, we need to learn how to protect ourselves. Wear a hat, wear the glasses, wear the clothes that cover the body, and you can take care of that one. The two probably highest occupations for cancers are dairy farmers and poultry farmers. Now, whether that's because they're eating so much of their own products or they are just around these different animals, I don't know which one it is, probably a little bit of both. This is a potent form of certain types of cancers, so stay away from these things. Radiation. One of my first patients at UT Pines had worked for the Savannah River plant, where there was lots of, apparently some radiation somewhere along the line, and he got cancer. Basically, it was an oral cancer. And so radiation, whether it is through the sunshine during the peak times of the day, basically between 10 in the morning and 3 in the afternoon, where we have more of the harmful rays. It could also be in a medical type of an experience. Have you ever gone to the hospital or the doctor's office and they were going to give you an x-ray? What do? They come out and they wrap certain parts of your body in this lead jacket, and then they skittle out of that room. They're not going to stay in there with you. They wear this little tag with them, this little thing that absorbs X-rays, and they have it tested periodically to see how much it is absorbed, because if it has absorbed it, he has absorbed it. Once you get X-rays, those X-rays are with you in your body, and so the deal is limit the amount of X-rays that you get. Some people go and get X-rays all the time, dental X-rays and X-rays for the most innocent causes. I would not get an X-ray unless I really felt like I really needed this X-ray. I've known people with broken bones says, look, you can tell the thing's broken, just fix it. I don't want an X-ray. And so those are one of the other causes of those things. Pollution. There's different types of pollutants that are carcinogenic. Now, one that we know very well from 30, 35 years ago was Agent Orange, that they use a lot in Vietnam. Those people who were sprayed with it or were in the area where the Agent Orange was are now coming down with many problems. Asbestos. Now, they're trying to get it out of all the buildings, but you know, it's interesting, when the World Trade Centers were destroyed, That was one of the last buildings, some of the last buildings built that used asbestos inside the building. I heard recently, and I've got to check this out, you can check it out too, but upwards of 50% of the policemen and the firemen who were in the area who survived now are out on disability because of the asbestos that was in the air. And asbestosis leads to cancer of the lung. They could have never smoked a cigarette in their lives, and this could be a problem. Cigarette smoking, there's another one. Whether it's active or passive, these things are potent forms of cancers in the body, and so we need to stay away from any form of cancers. Alcohol can precipitate cancers of the mouth, of the throat, of the stomach. Stay away from the alcohols. Dress, lifestyle, and the way people dress. People who bundle up, lots of people in the cold weather like to wear these big down vests and leave their arms hanging out. That causes, if you don't have that much covering on your arms or your legs, it causes the blood to shunt to the trunk, and when you congest the trunk, it leads to more breast cancer. And so we find that women who live in colder countries tend to have more breast cancer, probably because of the fact that we are slaves to fashion. We want to sit there and look all this neat because of our whatever it is. I don't know what drives a person to live a healthy lifestyle, Dr. Thrash, because I've seen some of these people dying of cancer, and it's not a pretty sight.
Yes. And we do have a lot of knowledge that can help us in these areas. Concerning overheating, not only overheating the chest, but also overheating the pelvic area in men can lead to cancer of the testis. For decades, we have known that if a little boy was born with his testis not down in the scrotum, but up in the canal, then that testis that was in the canal, never did come down, is something like 60 times more likely to get a cancer in it than the normally descended testis into the scrotum. So what urologists do is at about the age of 7 years, or certainly by the age of 15 years, a little boy whose testis has not descended properly will be, that testis will be simply removed. Most of the time, the other testis is quite capable of performing all the needs, all the functions that the young man would need ever. Now, another thing that we don't know much about but has been implicated in cancer is exposure to high-tension electric lines. This has not been proven yet, and some studies seem to refute the idea that electricity is involved in the production of cancer. But from the very first study, there was enough evidence to make me feel that we should try to locate our homes away from these high-tension power lines, believing that if it could interfere with the radio reception or TV reception, that it might be able to interfere somewhat in the electrical impulses that the body has, and thus interfere with the immune system. There are some infections very clearly shown to be involved in cancer. One of those is hepatitis C. Hepatitis C is common and getting to be more common, and we need to learn as much as we can about that so that we can avoid getting hepatitis C. Dr. Miller, would you talk with us some about hepatitis C and what to do to keep from getting it and so forth?
Well, hepatitis C, as we understand, is transmitted through blood and body fluids. And the problem with hepatitis C is its incubation period. It incubates in about 6 months. And all during that time, a person who has been infected with the hepatitis C virus is infectious, and they can pass it on to other people in their environment. And so it's very important to be careful. And how are you careful? You don't know who has it out there. Well, for the most part, those people who are at risk, and I'm not going to try to classify all those people who are at risk for hepatitis C, but certainly those who get blood transfusions, if somehow or other the blood bank has been polluted with this particular virus, those who are intravenous blood users, those who drug users, those people who engage in risky sex, and anything outside of marriage is risky sex. those things can be a major problem with transmitting it. And if someone doesn't know, then it passes it on down the line. And so we need to learn how, first of all, not to get hepatitis. It's a serious problem that a person has. It attacks, of course, the liver. And when a cell gets weakened, the cell opens itself up, or its cell is opened up, it's exposed to the opportunity of becoming invaded by cancer, becoming cancerous itself. And so we find that people who have hepatitis C, down the line, they are set up for things like cirrhosis of the liver or cancer of the liver. So what we need to do is first, don't get it, but if we do get it, there are some simple things that we can do to take care of ourselves. One, we need to take care of the liver. That's where it's going to attack. We can do hot fomentations, just a hot compress over the liver, and leave that there for a while, and do a cold sponging after that, and then to take a shower. You might even do a series of hot fomentations and then cold rubs, hot fomentation, cold rubs. What this is going to do is bring some more circulation and some healing into the liver area. The diet has to be clean as it can be. You got to stay off the sugars, you got to stay off the fats, you got to stay off the animal products, and eat a pure diet, as pure diet as you can find. Grapefruit seed extract would also be good for recovering the liver. I like to, for patients who have liver problems or want to sit there and rejuvenate their liver, take some lemon juice and some water each day. Lemon juice is extremely good liver tonic, and it'll be good for the liver. Garlic, extremely good for the liver, and I would recommend somebody with hepatitis to eat a lot of garlic. It may come out of their pores a little bit and make them a little bit antisocial, but I'd rather do, if I have hepatitis, you don't need to be all that close to everybody in the neighborhood anyway. There are a few herbs that you can take. You can take milk thistle, one of the best herbs for the liver. You can take bilberry, another nice herb for the liver. Golden seal, and then of course doing the hot and cold treatments I've already mentioned. I knew a person a few years ago who all of a sudden, out of the blue it seems, developed hepatitis C, and immediately went to work on it. Doing these simple things, she got that diet right, did the hydrotherapy right, took the herbs right, and within 6 months, she was negative for the hepatitis C. And I saw her a few years ago in Austria, and she's been completely well now for, well, it's been 7 or 8 years. And so if we grab the reins immediately, if we do get out of control, grab the reins immediately, bring this thing under control, it's a good chance that you can even beat this terrible disease, Dr. Thrash. And so that's what I recommend. Yes,
hepatitis is a very serious disease, and we can combat it. We've had some cases at UT Pines. We have advised their treatment, and they have gone through the herbal things and the lifestyle factors, and they have had a reduction in the liver enzymes that they have had. I personally have not had a case that has become negative to the serology tests for the virus. The stresses that we are subjected to all the time, these can weaken the immune system and make it so that we are more likely to develop cancer. People who have mental illnesses, especially those who are institutionalized, they tend to get more cancers than do people who are not institutionalized. Don't know exactly why that is, whether it's the medications that they take that may have some cancer-promoting activity, or whether this may be some innate feature of being mentally ill that weakens the immune system. Whatever it is, just as a class of patients, they do tend to get more cancers and to die a little earlier than other people do. Perhaps some of the inflammatory substances produced, which produce many chronic progressive illnesses, maybe some of these are involved in the shortened lifespan of people with severe hospitalizable types of mental illness. Now, there are sexually transmitted diseases that are known to be associated with cancer. One of those is syphilis. When I was in medical school, I remember that the man who taught us eye, ear, nose, and throat diseases said that there were 3 causes of cancer of the mouth and throat. And those were syphilis and poor oral hygiene and carious teeth. So I have come to believe that many of the sexually transmitted disorders or diseases can be associated with an increased risk of getting a cancer. Cancer of the cervix may be classified as a sexually transmitted disease. There is the human papillomavirus, and it can be transmitted from one sexual partner to another, and especially when there are multiple sexual partners in the life of an individual, we do know that there is an increase in the number of cases of cancer of the foreskin and cancer of the cervix. The human papillomavirus is one that is a virus that's involved in that. Then we know that the Burkitt's lymphoma, this lymphoma that's characteristic of people with AIDS and people who live in countries such as Africa. This is also apparently somewhat of a sexually transmitted disease. That matter is not entirely clear yet, but certainly there are some indications that it is true. Thyroid disorders, maybe because of a weakening of the immune system, possibly because of the taking of a hormone on a long-term basis. This could also be a feature in the formation of breast cancer. Not much has recently been presented in that in the medical literature, but a number of years ago there was an indication that in women who did not need to take thyroid hormone but who were taking it just because of some symptom that was apparently related to some other problem, such as being chilly in mild weather, or having some lack of energy or some other symptom that was just general, that these individuals would take thyroid over a long period of time to boost these functions, and they tend to have a slightly higher risk of getting cancer of the breast. Now, with studying all of these things, we see that infections are involved, that pollutants in our surroundings are involved, that certain lifestyle factors and food factors are involved in increasing our risks for getting cancer. There are many others. We have only scratched the surface of the known risks for cancer. We invite you and encourage you to study about these matters and to make yourself knowledgeable so that you can resist these increasing numbers of cancer risks in our society.